الرحمن الرحيم. الحمد لله رب العالمين، والصلاة والسلام على أشرف خلق الله سيدنا محمد ابن عبد الله عليه أفضل الصلوات والسلام. This lecture deals with the pathways from the body to the sensory areas in the cerebral hemisphere and the pathway from the motor area of the cerebral hemisphere to the body. Firstly, we are going to study the sensory pathways from the body. These are firstly, the pain and the temperature pathways. The pain and the temperature pathways from the body is as follows. The lateral spinal tract carries the pain and the temperature as pathway from the body as shown here. Firstly, the receptors for pain and the temperature pathway are the pain and thermal receptors in the skin and other tissues. These are the free nerve endings. From the receptors, fibers pass to the first order neuron. The first order neuron for the pain and the temperature pathway is the posterior root ganglion that lies on the posterior root outside the spinal cord. The central element or the axons of the posterior root ganglion entering the spinal cord proceed to the tip of the posterior gray column and divide into ascending and descending branch. These branches travel for a distance of one or two segments of the spinal cord and form the posterolateral tract of Locher. These fibers of the first order neuron terminate by synapsing with the cells in the posterior gray column, including cells in the substantia gelatinosa of Rolandi, which represents the second order neuron. The second order neuron in the pain and temperature pathway are the cells in the substantia gelatinosa. The axons of the second order neuron now cross obliquely to the opposite side in the anterior gray column and white commissures within the one spinal segment of the cord, ascending in the contralateral white column as a lateral spinocerebellar tract. The lateral spinocerebellar tract lies medial to the anterior spinocerebellar tract. As the lateral spinocerebellar tract ascends through the white column of the spinal cord, new fibers are added to anteromedial aspect of the tract. Thus, in the upper cervical segments of the cord, the sacral fibers are lateral and the cervical segment. In the cervical segments are medial. The fibers carrying pain are situated slightly anterior to those conducting temperature. The lateral spinocerebellar tract ascends through the brainstem to reach the third order neuron, which is the ventral posterolateral nucleus of the thalamus, VPLN, ventral posterolateral nucleus, VPLN. Now, the third order neuron in the pain and the temperature pathway is the ventral posterolateral nucleus of the thalamus, VPLN. It is believed that here crude pain and temperature sensations are appreciated and emotional reactions are initiated. The axons of the third order neuron pass through the posterior limb of the internal capsule and corona radiata as a sensory radiation to reach the somatosensory area in the posterocentral gyrus of the cerebral cortex areas 3 1 2. The contralateral half of the body is represented in an inverted manner with the hand and the mouth situated inferiorly and the leg situated superiorly and with the foot and genital region on the medial side of the cerebral hemisphere. From here, the information is transmitted to other regions of the cerebral cortex to be used by motor areas and the parietal association area. The role of the cerebral cortex is interpreting the quality of the sensory information at level of consciousness. These diagrams shows the pain and the temperature pathway as mentioned. The second pathway we are going to discuss is the light touch and pressure pathway. When we said light touch, we mean the gross touch. This is carried by the anterior spinothalamic tract. The receptors of light touch and pressure are mechanoreceptors present in the skin, and other tissues are the free nerve endings. The first order neuron in this pathway is the posterior root ganglion. The axons enter the spinal cord and from the posterior root ganglion and proceed to the tip of the posterior gray column, where they divide into ascending and descending branches. The second order neuron is in the substantia latinosa oblongata in the tip of the posterior gray column. The axons of the second order neuron now cross very obliquely to the opposite side in the anterior gray and white commissures within the several spinal segments and ascends in the opposite side in the anterolateral white column as anterior spinothalamic tract. As the anterior spinothalamic tract ascends through the spinal cord, new fibers are added to the medial aspect of the tract. Thus, in the upper cervical segments of the cord, the sacral fibers are most laterally and the cervical segments are most medially. As the anterior spinothalamic tract ascends through the medulla oblongata, it accompanies the lateral spinothalamic tract and spinotectal tract, all of which form the spinal lemniscus. The spinal lemniscus continues to ascend through the posterior part of the bones and the tegmentum of the midbrain and the fibers of the anterior spinothalamic tract terminate by synapsing with the ventral posterolateral nucleus of the thalamus, VPLN. The third order neuron here is the ventral posterolateral nucleus of the thalamus. Crude awareness of touch and pressure is believed to be appreciated here. The axons of the third order neuron in the ventral posterolateral nucleus of the thalamus pass through the posterior limb of the internal capsule and corona radiata, forming what's called sensory radiations to reach the somatosensory area in the posterocentral gyrus of the cerebral cortex. The contralateral half of the body is represented inverted, with the hand and the mouth situated inferiorly as described previously in the pain and temperature pathway. This figure shows the light touch and pressure pathways. Now we are going to study the discriminative touch, vibratory sense, and conscious muscle joint sense or proprioceptive sensation. The proprioceptive sensation traveled by a pathway formed by gracile and cognate tracts, or called fasciculus gracilis and fasciculus cognatus in the posterior white column, as shown here. The receptors for proprioception present in skin, joint, and the tendons of the muscle. The first order neuron is the posterior root ganglion. The axons enter the spinal cord from the posterior root ganglion and pass directly to the posterior white column of the same side. Here, the fibers divide into long ascending and short descending branches. The descending branches pass down to a variable number of segments, giving off contralateral branch that synapse with cells in the posterior brachion, with intranuclear neuron and with the anterior horny cells. It is clear that these short descending fibers are involved with the intersegmental reflexes. The long ascending fibers travel upward in the posterior white column as fasciculus gracilis and fasciculus cognatus. The fasciculus gracilis is present throughout the length of the spinal cord and contains the long ascending fibers from the sacral, lumbar, and the lower 6 thoracic spinal nerves. The fasciculus cognatus is situated laterally in the upper thoracic and cervical segments of the spinal cord and is separated from the fasciculus gracilis by a septum. The fasciculus cognatus contains long ascending fibers from the upper 6 thoracic and all the cervical spinal nerves. Now, the fibers of the fasciculus gracilis and fasciculus cognatus ascend ipsilaterally and terminate by synapsing on the second order neurons in the nucleus of the gracile and cognate nuclei of the medulla oblongata. The second order neuron nuclei gracilis and cognatus of the medulla oblongata. The axons of the second order neurons, called internal arcuate fibers, sweeps anteromedially around the central gray matter and across the median plane, decussating with the corresponding fibers of the opposite side in a sensory decussation in the upper half of the medulla oblongata. The fibers then ascend as a single compact bundle called the medial meniscus through the medulla oblongata, bones, and the midbrain. The fibers terminate by synapsing on the third order neurons in the ventral posterolateral nucleus of the thalamus. This figure shows touch proprioceptive sensation pathway from the third order neuron, the ventral posterolateral nucleus of the thalamus. Sensory radiations pass to the sensory somatic areas 3, 1, and 2 in the cerebral cortex. In this manner, the impressions of touch with fine gradation of intensity, exact localization, and two-point discrimination can be appreciated. Many fibers in the fasciculus cognatus from the cervical and upper thoracic segments, having terminated on the second order neurons of the nucleus cognatus, are relayed and travel as axons of the second order neuron to enter the cerebellum through the inferior cerebellar peduncle of the same side. The pathway, this pathway is referred to as cuneo-cerebellar tract, and the fibers are known as the posterior arcuate fibers. The function of these fibers is to convey information of the muscle joint sense to the cerebellum. Now we are going to study the corticospinal tracts, or called pyramidal tract. Origin. The fibers of the corticospinal tract arise as axons of the pyramidal cells situated in the fourth layer of the cerebral cortex. About 1/3 of the fibers originate from the primary motor cortex, area 4. 1/3 of fibers originate from the secondary motor cortex, area 6, and 1/3 originate from the parietal lobe, somatosensory area, areas 3, 1, and 2. Thus, 2/3 of the fibers arise from the pre-central gyrus, and 1/3 of the fibers arise from the post-central gyrus. Course of the corticospinal tract. The descending fibers converge in the corona radiata and then pass through the posterior limb of the internal capsule. The tract then continues through the middle 3/5 of bases, pedunculi, or crus cerebri of the midbrain. On entering the bones, the tract is broken into many bundles by the transverse pontocerebellar fibers, the medulla oblongata. The bundles becomes grouped together along the anterior border, along the anterior surface, to form a swelling known as the pyramid, hence alternative name pyramidal tract. At the junction of the medulla and spinal cord, most of the fibers cross the middle line at motor decussation at the lower part of the medulla, or at the junction of the medulla oblongata and spinal cord. After decussation, enter the lateral white column of the spinal cord to form the lateral corticospinal tract. The remaining fibers don't cross in this decussation, but descend in the anterior white column of the spinal cord as the anterior corticospinal tract. Termination of the corticospinal fibers. These fibers eventually cross the middle line and terminate in the anterior gray column of the spinal cord segments in the cervical and upper thoracic regions. The lateral corticospinal tract descends through the whole length of the spinal cord. Its fibers terminate in the anterior gray column of the all spinal cord segments. Most of the corticospinal fibers synapse with internuncial neurons, which are in turn synapse with alpha motor neuron and some gamma motor neuron. Only the largest corticospinal fiber synapse directly with the motor neuron. Note: the corticospinal tracts are not the sole pathway for serving voluntary movement. Rather, they form the pathway that confers speed and agility to voluntary movements and is thus used in performing rapid skilled movement. Many of simple, basic voluntary movement are mediated by other descending tracts.